we have 30-year-olds in the intensive care unit on full ventilation.
Young people are going to see their friends and neighbors and colleagues get sick.
BC hospitals are overwhelmed. That's the message from two doctors who are speaking out from the front lines as the province's COVID case numbers mount.
Part of the issue and that we'll continue to see, and we've seen for years, is people coming to work when they're not well, and that is how those illnesses get spread.
As COVID case numbers rise, there are renewed calls for government to better support workers who are sick.
The problem, I think, from the very beginning is that travel was not taken very seriously in this country.
Can British Columbia do anything more to discourage non-essential travel besides telling people not to go? Just ahead, we take a look at the province's messaging and if it's really working.
It's been as busy as we've seen in maybe 15 years.
As COVID cases continue to rise, BC hospitals are feeling the pressure. And now there's serious concern as to whether intensive care units can cope with the number of variant cases coming through the doors.
In the first wave of COVID, we did not get that many young people that were sick. I think that's different now.
Dr. DeRosa is the head of medicine at Royal Columbian Hospital in New Westminster. He says they are running out of staff to care for the number of people coming through their doors.
At some point, we will kind of stretch our capacity to a point where we have to make tough decisions. And what I mean by that is, we've tried very hard to prevent shutting down other aspects of medical care. Operations, we're still trying to keep going. Diagnostic procedures, cardiac catheterizations for patients who may need heart surgery. All those sort of things we've tried to preserve and still look after the COVID patients.
So I think that we now have a huge outbreak of a very aggressive variant of coronavirus in our local catchment area.
Dr. Dorscheid, who works in the critical care unit at St. Paul's Hospital, says hospitals in Vancouver Coastal Health have been able to manage the load a bit better than Fraser Health because the case count has typically remained lower. But he's extremely concerned that with the number of variant cases in VCH, that could all change.
The Vancouver Coastal Health Authority now has the second highest concentration of P1 variant in the world, second only to Brazil. And, we know that the contagiousness of that or infectivity of that virus is at least twice, COVID-19, the wild type. And we know that severe illness and mortality are higher than the wild type virus.
After being on the front line of the pandemic for over a year now, both doctors are pleading with the public to do their part to stop the spread of the virus.
It's hard when you're not there and you don't see it. I get it. And, we've been telling people for a year that it could be dangerous. And I think sometimes if it doesn't happen, you sometimes think, well, everyone's crying wolf then. But it's not. It could be very devastating for your health if you get COVID at the present time.
In New Westminster, Ashley Burr, City News.
BC health officials announcing Easter weekend COVID-19 numbers today, with a 4-day total of just over 4,000 new cases. From April the 3rd to 4th, there were 999 cases, and in the last 24 hours, 890 new cases reported. There are currently 8,490 active cases in the province and just under 12,000 people who are under public health monitoring. Since the beginning of April, there have been 916 new confirmed variant cases. Fraser Health has declared a COVID-19 outbreak at Chartwell Langley Gardens, an assisted living and long-term care site. 5 staff members there have tested positive. The staff members are currently in self-isolation at their homes. Tomorrow, eligible adults in BC can book their COVID-19 vaccine appointments online as Phase 3 of the immunization program begins. Starting at 8 a.m. Tuesday, British Columbians over 71, Indigenous people over 18, and some who are medically vulnerable can book. Options to make appointments via phone or in person at a Service BC location are still available. Fraser Health's self-serve vaccine booking tool will no longer be available as they transition to a provincial system. 2 restaurants that defied public health orders over the weekend have had their business licenses revoked. Corduroy Restaurant in Kitsilano and Gusto in Olympic Village will receive suspensions from the city for at least 2 weeks. Both restaurants allowed indoor dining to continue despite public health orders announced last Tuesday. Videos of a packed Corduroy restaurant on Saturday showing patrons chanting at two provincial health officers to get out. In response to the incident, Health Minister Adrian Dix says while these restaurants will be held accountable, most restaurants are doing their part to keep the community safe.
I would note that all of the attention that's been given to those two restaurants, the real thing that we should all be both appreciative of and recognize, is all of the other restaurants, which are in the thousands, in the tens of thousands perhaps across BC, who are following the rules. And we need to support them, those that are providing takeout, by getting takeout if we can, and recognizing the impact on them. The way bigger story, it seems to me, is the 99.8% or 9% of restaurants that are following the rules but are dealing with what is a very, very challenging situation for their businesses, and these are important in our community. That's the big story. These two restaurants, of course, they're violating the rules, and the rules will be enforced.
The important thing to understand is that they are variants of concerns because they're coming out much more strongly than the initial virus.
COVID variants are driving Canada's third wave, and medical experts say variant outbreaks underline the very real danger COVID still presents.
Long before the pandemic even ever started, we've been calling for paid sick leave.
Not everyone can afford to take unpaid time off when they're experiencing what could be COVID symptoms. That's why advocates are calling on provinces and the federal government to step up on paid sick leave as COVID-19 cases continue to rise, particularly among younger adults.
Part of the issue and that we'll continue to see, and we've seen for years, is people coming to work when they're not well, and that is how those illnesses get spread.
The BC Federation of Labour and Unifor both welcome the latest update to BC's Employment Standards Act, ensuring that employees can take unpaid time off to get the COVID-19 vaccine, but say more needs to be done.
We know that workers are struggling right now, just day to day with their wages, and losing a couple of hours of pay to go and get a vaccination could be very harmful for someone.
There's a financial burden, and people really need that coverage to make sure that they can go home and isolate or stay home if they're sick. The failure to do that now for over a year is really leading to the kinds of lockdown that we saw this week, the further restrictions.
Currently, the Canada Recovery Sickness Benefit offers $500 a week for up to 2 weeks for those who are sick or have to self-isolate due to COVID-19. But critics say that benefit falls short.
It pays less, it's harder to claim, it's more unwieldy, and it's simply not responsive to the needs of employees to be able to call up their employer and take some time off if they're sick, if they're feeling unwell, or if they need to get tested.
In a statement, Minister of Labour Harry Bains wrote, "I will continue to raise concerns about gaps in the program with the federal government and work with them on possible solutions, because it's in all our best interest to have a paid sick leave program that ensures all Canadians have the protection they need." The minister added consultations have begun exploring a paid version of the vaccine leave.
I feel confident when I hear, elected folks talking about paid sick leave and talking about pay for vaccinations and things like that. I think we'll get there. That's my hope.
Paid vaccination leave is just the bare minimum. We need paid sick days for workers to go home and isolate if they need to.
But as the third wave of the pandemic continues to hit hard, paid sick leave could alleviate the stress of choosing between staying home when sick and paying essential bills.
If you have to choose between paying your rent, feeding your children, and putting a roof over everyone's head that you have a responsibility for, you're going to go to work.
Miranda Fatour, City News.
A man has been killed on Vancouver's downtown east side. Vancouver police say the man was found on Hastings Street near Carroll Street Sunday night, and it was initially believed to have been suffering from a drug overdose. Paramedics later realized he had been stabbed. The man later died in hospital. This is Vancouver's fourth homicide of 2021. A man is dead after a fire broke out in a basement suite near the border of Delta and Surrey this morning. Crews responded to the fire at a produce store at 96th Avenue and 117 B Street. A total of 10 trucks and 30 firefighters responded to the call from both Surrey and Delta fire departments. 4 occupants in an upper residential unit got out safely, but the single occupant downstairs was found by firefighters.
Delta fire trucks arrived first. They were told that there was an occupant in the building. They commenced fire attack, and they found a person in the basement suite and managed to get that person out. Unfortunately, that person was deceased.
The cause of the fire is still under investigation. Police are still searching for 2 suspects after a break-and-enter in Horseshoe Bay. Shortly before 2 a.m., West Van police were called to this convenience store on Royal Avenue after reports that a truck had driven into the store. 3 suspects fled on foot after the truck got stuck. 1 suspect was found with the help of a canine unit, while the other 2 are still at large. The truck was stolen from Vancouver. No one was injured in the incident, and any information that you may have is being asked to be shared with police or Crime Stoppers.
I just can't be more clear on this. If you don't need to travel, don't travel right now. If you don't need to travel, don't travel.
Is BC's health minister really being clear? The province continues to advise British Columbians to avoid non-essential travel, but these words didn't stop travelers from spending their spring breaks in different health regions.
If people don't have enough common sense to stay at home and not travel, then I guess these people need a law to stop them from doing it.
You know, why hasn't the government required people not to travel? Because this is clearly an issue. We have a serious problem with variants. We missed the boat on that. And now it's almost like too late to close the door because we've let them in, they've spread around the province, and they're causing serious uptick in cases.
We asked BC Ferries if they were doing anything beyond reminding its customers to avoid non-essential travel, but they didn't offer any specific efforts, saying in an email that BC Ferries is not an enforcement agency.
What good are the province's advisories without any concrete actions?
It's like a parent who keeps raising their voice or furrowing their eyebrows, right? And yet there's no consequences. So then the child still misbehaves or doesn't comply with what you're asking them to do. And it kind of feels like that, like the minister, raising their voice, pleading with people over and over again, but it's all a recommendation, an advisory, guidelines, and people hear that. They don't hear requirement. They don't hear order.
In January, Premier John Horgan said BC would not ban or restrict interprovincial travel after finding no legal basis for preventing people from traveling to and from BC.
We can't organize, we can't have armies of people enforcing those rules.
It's about creating disincentives. You don't have to come down and, post sentries along the highway or create, these outposts. We could introduce mandatory quarantine for non-essential travelers coming into the province. That may be logistically challenging, but it actually encourages people not to come. And so that was something we recommended in January, and it was introduced actually in Manitoba, and it's been practiced in the Atlantic provinces. They have very little variants at the moment as a result.
It's uncertain if the province will do anything more to discourage non-essential travel. For now, the health minister continues to appeal to potential travelers.
This is the time to listen to your heart and listen to your head and listen to the guidance of public health and not travel.
In Vancouver, Keir Junos, City News.
The important thing to understand is that there are variants of concerns because they're coming out much more strongly than the initial virus.
We're all learning more about the different variants of COVID-19 as they continue to spread across Canada. Health Canada reporting nearly 11,000 cases of the B117 variant and nearly 500 cases of variant P1 first seen in Brazil. Virologists and epidemiologists say the current data suggests those variants could be more than twice as transmissible as the original virus.
Some people are actually referring it to as 2.5 times more transmissible, although the value will probably lower. But nonetheless, that is sufficient for that variant, that virus, to be much more transmittable and to create those types of exponential growth curve.
It is far more contagious. The B117 variant, which is the most common, is definitely more contagious. We think the other ones are too. It's hard to measure, but that means less exposure time and it means lower viral dose, or both ways that you can still get sick. So if you go to the grocery store or if there's a child attending school, they may be exposed to COVID and not just at enough dose to make them sick. So now the bar is lower.
P1 is hitting Western Canada hard right now, with BC reporting 379 P1 cases on Thursday. That's more than any other jurisdiction outside the country where it was first detected. Alberta has reported 600 variant cases but didn't specify which strain. But over the weekend, Alberta health officials announced a significant P1 outbreak now under investigation. Virologist Benoit Barbeau says virus mutations occur all the time, but only the fittest mutations survive and spread to become new variants. Perhaps the best illustration of the danger of this fast-moving variant, the Vancouver Canucks now have 16 of their 22 players on the NHL's COVID protocol list, with a number of them reportedly showing variant symptoms.
There's not only the players that are on the list, but there's also 3 members of the coaching staff who's been affected and a couple members of the taxi squad. And basically what the NHL decided to do as of the weekend was say, we're going to act as if everybody is going to be affected.
It goes to show that existing levels of vigilance aren't enough. So clearly, somehow there's a loophole there. And I think that if they worked back and looked at it, it would be found where there was some contact that shouldn't have happened. And again, with non-variant COVID, that may have gone nowhere or may have led to something so mild that it wouldn't even have been noticed. But the variants are far more likely to be transmitted, and that's what this, I think, is showing.
The Canucks outbreak is unique, happening inside a strict bubble that sees daily testing and chiefly among young, physically fit men. Barbeau says this underlines the difficulty of managing risk of exposure.
You know, there's no zero risk. I mean, even though if you're wearing masks, you're very careful, and you know, there's always possibility that you can be infected. So remind yourself that if you do all those measures, at least you're reducing substantially the risk that you're getting infected. But the zero risk doesn't exist.
While there may be no such thing as zero risk, the ways of lowering your own personal risk remain the same as ever. Wash your hands, mask up, and try to stay at least 2 meters away from people who aren't in your own personal bubble. In Ottawa, Xiaoli Li, City News.
A new training program is aimed to improve BC road safety. New mandatory entry-level training for new Class 1 commercial licenses will be required starting in the fall. BC's Class 1 MELT program is for new drivers of heavy commercial vehicles and involves a minimum required number of practical behind-the-wheel driving hours, in-yard hours, and theoretical instructional hours. The province says the program will better prepare drivers to operate safely across BC's changing climates and make the roads safer for all.
How will the legacy of April 6, 2018 live on? The tragedy of the Humboldt Broncos bus crash brought a community and country together to support 29 families impacted. And soon the site of the crash will hold a permanent monument.
Tribute to those affected by the crash is going to help our community just move one step further down the road. It's been tough on a lot of people.
As we head into the 3rd anniversary, fundraising begins to also build a Humboldt Broncos tribute center in the small Saskatchewan city to remind us of that moment that made Canadians from coast to coast to coast pause.
Opportunity for the tribute center to inspire not only the community but the country at large.
I think it would be very special to be able to help different people around the hockey world shed a light on how special those people were for the hockey world as a whole. I think would be something super monumental, because I mean they were incredible people.
Survivor Tyler Smith speaking in a video message to support the center, joining the sons of late coach Darcy Hogan, credited for creating a hockey culture that encouraged each player to not just be his best self on the ice but off, with his core covenant starting with family first.
To treat my teammates and coworkers with respect.
To be thankful for the opportunity to wear the Bronco jersey. To play each game and practice with passion and determination.
To conduct ourselves with honesty and integrity.
Family members speaking in Humboldt today. The mother of Dana Bronze, the athletic therapist who was one of the 16 lives lost, remembering the awe of the outpouring of support from Canadians.
And I hope this permanent symbol of this kindness and love will bring hope and healing to everyone affected by April 6th and inspire others to live the core covenants.
A website set up to track the fundraising, thinking it'll take about 2 years to build the hockey-focused tribute center, hoping to build a roadside monument sooner. Tuesday, the city of Humboldt will be hosting a memorial at 4:30 p.m. Central Time. There will be a moment of silence and church bells ringing at 4:50 to mark the exact 3-year anniversary of the crash.
And Wednesday, April 7th, the family of Logan Boulay encouraging everyone to wear green for Green Shirt Day and talk to their loved ones about their wishes with organ donation. To remember how one hockey player was able to save more than just the lives his organs were donated to, but also encourage over 150,000 people to sign up for organ donation. From Edmonton, Carly Robinson, City News.
Vancouver's news is always available on the radio with News 1130 or online anytime at citynews1130.com. And your next edition of City News is later on tonight at 11 o'clock. Thanks for watching and have a great night.